Lovely.
And then also I had some about mental health. It's really scary out there with anxiety, but hi, everybody. Alida Hernandez here again, Rebooted Mindset, a Spanglish entertainment production. And today we have an exciting guest. I'm always trying to bring different things to you out there for all ages. And today we have CEO and founder of Bluebird Kids Health, Mr. Chris Johnson. He's going to be coming in talking about this great thing that he's doing here. He has some first practices here, doctor's offices, a pediatric offices here in Florida, which is exciting. And see how we can change the way we help our kids out there with their health so they can live long lives, okay, and maybe make it to 100 or something. So anyway, we're going to find out from Chris what this collaboration that he's done, and let's bring him in. So good day, Chris. Welcome, Mr. Johnson, to our show.
Good morning. Thank you for having me.
It's an honor to have you here. This was a really something really good to hear about pediatric care. So I'm looking forward to learning more about you and how this venture came about.
Absolutely. We're excited to share the story.
So you are originally out of Boston, correct? That's where you are now, or Massachusetts?
I am. I guess a darn Yankee. I can handle the cold weather. The warm weather, I'm learning how to survive. I don't know how you guys make it through the summer sometimes.
I'm from New York originally, so I was born and raised in New York City. So I had the cold and everything like that, and got tired of it.
Yeah.
So it gets a little over hot here. Okay.
I've learned to really look forward to the afternoon showers, especially in the summer, to cool things off a little bit.
Yeah, or jump in the pool.
That's right.
So how long have you been in the medical field, like working in the medical field?
I've spent most of my career in healthcare. I'm not a clinician by background, but have been in kind of the strategy consulting, technology side, and then for the last decade or so have run various medical groups that are building primary care models to provide better access to primary care for disadvantaged, not disadvantaged, but patient populations that struggle to get access to care. Currently at Bluebird Kids Health, very focused on getting more access to children to pediatric primary care. Prior to this, at an organization called Landmark Health, providing in-home primary care to seniors with serious illness and frailty challenges across the country.
There's a challenge, I think, across the board for healthcare. Just in general, I think sometimes, because I struggle myself just trying to get a doctor's appointment.
It's I think of the U.S. healthcare system as being kind of this interesting tale of two cities. On the one hand, it's a really amazing healthcare system. We do some incredible things. We are curing people with cancer today. We have folks who lose limbs in wars and they're running marathons. And so kind of the technology innovation that has happened is like truly, truly, truly amazing. And I think it's what we've prioritized. We've incentivized that as a society to get that type of outcome. And it's really been remarkable to see, even in my lifetime, the advancements that we've made. Yeah. But then the area where we've struggled a lot more is how do we actually just help people live healthy lives? How do we ensure that all folks have access to care that really helps to maximize like day-to-day living, day-to-day outcomes? And that's what I've focused most of my career on, is how do we bring really high quality community-based care care models that integrate both the physical well-being, the mental well-being, and the social well-beings of an individual and their caregiver's journey, so that they can live healthy, meaningful lives. And especially for children, that's so important, right? Like we have the privilege of really being with kids and their parents from the very beginning, where every child really has this opportunity to have an amazing trajectory through life. And I view pediatrics as this opportunity to really help nudge them to stay on trajectory, to make sure that we're doing early interventions, to make sure that if a child has a challenge seeing the blackboard or the whiteboard, I guess now in schools, like we're getting their eyes checked so that they stay engaged. And that intervention in second grade, in third grade, is really what's going to make sure that they maybe grow up to love reading versus start hating reading, and all of a sudden they're dropping out of high school. There's another path where they're making it through high school. They're really feeling like they're succeeding in life. And I think that's the really amazing thing about in my career, having spent some time with seniors where there's an amazing opportunity to do well, but come to kids where you're really helping to set them up on a not just year to year, day to day journey of health, but hopefully a lifetime of being able to have a really successful personal and professional career.
That's incredible, because I think that we have to start when they're children, right? Teach them the right way when they're young, so that way you don't see the childhood obesity that we're seeing, and diabetes and heart. I mean, just ridiculous stuff you see in children now. That is, each generation changes, correct? So I was born in the 60s. Back then, we didn't have the fast food that you have now, right? We didn't go out to eat. We ate at home. It wasn't, McDonald's. What are you kidding me? Pizza, baby. Pizza in New York, there's always pizza. But life was different. Food was different also.
No, that's exactly it. I think that there's both, the world continues to evolve, and we're very fortunate in this country that there's a fair amount of innovation that's happened in broader society. There's also been the challenge of, hey, we have so much food. There's very few folks who don't have access to a meal today, but that can also have, is it the right type of meal? Is it the right type of food? And so being able to educate folks on how to make the right choices, helping parents understand what the right the way to have the right outcomes for their children is very important. And it's other conditions that we know how to manage. So like a big challenge in children are respiratory challenges, asthma, allergies, and kind of the interplay between those. And the really great news is we know how to manage those conditions. There's certainly some kind of environmental things that we want to be better. We want to have better housing. We want to have less smog in cities. But even if our children have these conditions, we have great medications and great ability to actually be able to manage that, so that they don't get into respiratory distress. But it's confusing and it's complicated. You have multiple types of inhalers. There's different triggers that you have. And a big part of what what we do at Bluebird Kids Health is really help to educate the caregivers of these children and the children themselves, so they understand what the condition is that they're managing, and they feel empowered to be able to actually take care of themselves at home and in the community. And when they need a hand, they can call us, they can text us, they can get really quick access to a care team that's invested in helping them be able to stabilize their condition, not need to worry about going to an emergency room, which is never a fun experience. You're grateful they're there, but you'd hope not to have to go. We're able to really help empower the patient and their family to be able to manage that in generally the confines of their home.
That's very good, because being a parent is not easy as it is. And if you're a new parent, you have no clue what's going on. I remember when I had my first son, it was like, oh, he has the sniffles, run to the emergency room. Like, you don't know what to do. You're like, is he really sick? And they look at you, ma'am, it's just a cold. It's okay. You can go back home,
and again, I caveat this with, I'm not a physician or pediatrician, but I sometimes jokingly think one of the primary diagnoses in pediatrics is parental anxiety, right? Is like, how do you help? And it comes from a good place. Parents want to do the best for their child, and it's new, it's confusing. And as a group, we seek to really be able to have the parent feel reassured that they're doing the right thing, be able to make sure that they're they know that they're going to the end of the world and doing the right thing for their child, and being that reassuring voice with the caregivers.
That's very good. So you're incorporating basically education with the healthcare. So it's not like you just come in and you bring your child in. Oh, it's vaccine time, or boost, whatever you need, and you just go. Like they actually speak to the parent. Like this is what this is for, helping them with nutrition, which I think is awesome because nobody really does that.
Yeah.
They don't do that, and I get concerned about the amount of child cancer that there is, and I always wonder what is going on. There's no reason a 6-month-old or a year-old child should have cancer.
Yeah.
So, hopefully those things will come out that people can help about, because they say about environment, food, different things. There's a lot of challenges when you are lower income.
Absolutely. And, I think there's certainly the education component. And then the other aspect is access to care. So a lot of young families struggle to get access to high quality pediatric care for their children. And that was a big insight behind the founding of Bluebird Kids Health was, in the United States, around half the children in our country are actually receive payment for their child's care through Medicaid. It's a pretty shockingly high percentage of the population. Again, I'm always a glass half full, glass half empty view. I think the glass half empty view is like it's really a shame that so many families struggle to receive access to healthcare. The glass half full is I'm glad that as a society we've all agreed that kids all deserve access to some form of healthcare services. Yeah. But there's been some knock-on impacts. You often see that pediatric practices are disproportionately located in kind of the wealthier zip codes in most major communities due to kind of some of the regulatory pressures around Medicaid payment rates. Often a pediatrician will receive a higher compensation for seeing someone who's on commercial insurance versus on Medicaid. And that causes them to, not for nefarious reasons, but just for to survive. A lot of pediatricians are small 2, 3, 4 provider practices. It's very hard to survive on the rates that pure Medicaid provides. And so that's really created a big access challenge. And so what we view as like one of the biggest opportunities that we're doing is trying to democratize access to care. So we locate our practices in generally in like high traffic retail areas, places where communities are already going, oftentimes like next to the local supermarket. So that's very as convenient as we can be, having extended hours. And then we partner with the Medicaid payers in value-based care arrangements where we are compensated for some of the outcomes that we generate, both improving the quality of the care that the children receive, but also being able to show that we can reduce the amount of emergency room visits that they have, the amount of inpatient visits that those children receive. And that's not because we are preventing care. We're actually making sure that they're getting the right care in the right place, and they're not going to the emergency room for a runny nose or for a cough, because we're able to help them in a more convenient location.
That's a good option because, like I said, as a mother and having little kids, when my kids were little, now they're grown. So, but it's always hard, especially if you're a single parent and you're trying to juggle 2 kids and you're trying to get to a doctor and the doctor can't see you. You need to have somewhere to go. And that's usually the scariest part, is being a mother by yourself with 2 kids and one of them sick. And you're like, what do I do?
Yeah. I can't, I'm not a mother, but I have young children at home, and the thing I've noticed is they always tend to really get sick in the middle of the night. Right. And it's kind of the time when you're most anxious, things aren't open, being able to sometimes getting in touch with your pediatrician can be challenging.
Yeah.
You leave a voicemail, you look at the phone, you're desperately waiting for the call back. And we're trying to innovate that model so that folks can get more rapid feedback. We have availability oftentimes the next morning to see any child who really needs a visit, to help kind of tuck folks through the evening, and be able to reassure them that like high quality care is available in the morning. Obviously, if there's something more dire situation, we refer them to go to the emergency room. But I think a lot of times people just need to be reassured that it's going to be okay till the morning, and then have kind of a convenient opportunity to come in and see their provider. That's what we're trying to do. I think like a big core of our operating model is certainly exceptional clinical care, but trying to build the tools and the platform that deeply empathizes with the challenges of being a parent, both the logistical as well as emotional challenges of trying to do the right thing for your kids.
Yeah, it's like bringing back customer service, like a person, not press 1, press 3, press 4. I think we need more community.
Yes.
I think over the years, I think people are realizing that we need to get back to the old school, like we used to do in the 60s. We had a community. You lived in a neighborhood. Everybody knew each other. You didn't have to worry about your child because the neighbor will watch him anyway, or he'll discipline him. You know what I mean? If he did something bad in the corner, forget it. Miss so-and-so in the corner will get him before you got him.
Absolutely. I think that those relationships are super important. And that's, I think my caveat being like, we're trying to figure out how do you have technology brought in that enables that and supports that, because there's a lot of things that we can identify, like folks who are at rising risk for respiratory challenges. And we want to be proactive about outreaching, things that we probably couldn't do back in the 40s and 50s and 60s, but we can still have that, personal relationship with each of our patients and their family, and then have a lot of technology that works in the background that's really helping enabling our providers on the front line. And that's how we've thought about it. Ironically, in my last role, we were doing old-fashioned house calls, right, with seniors. We actually went into the home, but it was empowered, which seniors love, because they're like, wow, this is like kind of what it was like when my parents were.
Exactly.
But it was kind of powered by a lot of technology on the back end that allowed us to be, operationally efficient and understand the right types of care plans that we needed to have for those folks. And so there's a similar view here of, we want to have the human touch be incredibly important part of our model, but we also know we need to leverage the technology to be a 21st century medical group in practice.
Yeah, we have a lot of technology now. I'm not sure how that works in there, but we got AI, we got so many different things. I use different tools for things, and it's awesome. And especially now I see they're doing it for surgeries and things like that you're getting like the AI background, so you can do surgery better and things like that.
That's beyond definitely over the tips of my skis. As we say,
I do a lot of reading, so I read a lot. So there's a lot of things out there. Even if you watch, sometimes you watch regular television, I like to watch the Chicago Med and the Fire, that kind of thing. And so I'm always curious about medical stuff, what are they doing, kind of thing.
Yeah.
I don't know if I could do it, but I like watching it. And they had a thing on one of the shows that showed this new technology that basically it does a 3D imaging of your insides out here, so you can exactly see everything. It was just crazy. And I don't doubt it that they have that. They probably have something that out there,
Yeah. I think what we're really excited about in that regard, maybe less cutting edge, but I think what we're seeing is a lot of the diagnostic tools that you used to have to go into a physician's office, right? Like the ability to have otoscopes that can see into your eardrums. The price points of those are coming down so much, and everyone has such powerful, phones, whether it's a Samsung phone or an Apple phone, or they all have this incredible computing power that we're really optimistic. It will always be a physical practice, but that a lot of those things that happen in the middle of the night, as it's if in the future it's $5 for a video that can take an image of your ear, if that's become standard of what everyone has, I think it'll just continue to enhance the ability of our pediatric practice to meet folks in their context, in their moment, in a way that, again, does right by the kids and has the parents really feeling, okay, this is a trusted partner who has my back, and it's going to help me do the right thing for my kids.
Yeah. That's the main thing, right? We, as a parent, we want to trust the doctor. We want to be able to that, I had a situation one time, one of my childs was sick and just constantly being sick, and they kept doing exams. They couldn't find it. And I was getting upset, and I said, I'm sorry, but do more blood tests. You got blood, test everything. And they finally found out he had Epstein-Barr. And and he was like 5, like little, and they were refusing to do it until I had to push it. So it's sometimes, it's that building that relationship with the doctor, that you feel confident enough in going, doctor, there's still something wrong. Like, that they can listen to you, because if I didn't push that and my doctor was willing to do the test, we would have never found it.
Absolutely. And I think especially in kids, right, the caregivers are the eyes and the ears of the diagnostics. And so it's incredibly important to understand what normal is and understand when a parent's saying, hey, this still isn't normal. There's still something. Exactly. And I think there's both an art and a science to doing that. I think there's the clinical, making sure you understand the clinical medicine, but also making sure that you have kind of, we're not a hospital, but I'll steal the hospital term, kind of the bedside manner.
Right, exactly.
Listening, seeking to understand, and until you get to the bottom of the issue.
Yeah, I think all of us as a patient, right? If you're a patient, you want to be able to, when you go to the doctor, that they're nice to you, that they give you the time of day, you need that bedside manner. And some doctors are still learning, right? Some doctors just don't get it.
And one of the great things about, not to, make a broad generalization, but I think like a lot of pediatricians go into pediatrics because that's what they love. They love kids. They love spending time with those children. And it's really such a privilege for me to be around this team, who I know will go to the end of the world to do what's right for their kids. And that's where they draw their energy. And that's a big part of the culture of Bluebird Kids Health, is making sure that those are the types of individuals that we bring onto our team. And that, at the end of the day, like our organization, we've built a lot of technology and stuff, but like we're a people organization, and the way that our team members feel is what's communicated through to the front line, to our customers, to our patients, to their family members. And it's really special to see that when it just plays out dozens of times every day across our offices.
That's what it is about. It's about people, right? About connecting with them and their heart, and really having that connection with that person, and building that community. And talking about that community, so you're here in South Florida. So
we are.
I just saw you're in Boynton Beach, you're in West Palm Beach, and there was one more I forgot.
In Loxahatchee as well.
Loxahatchee. So those are very populated areas. Boynton Beach grew a lot. West Palm Beach is saturated. So there are tons of kids, tons of schools. So I think you will be very busy in those areas.
We are, and we're very fortunate. We've actually partnered with a practice that was in the area already, called Palm Beach Pediatrics, that had been around for about 40 years, and just an exceptional practice owner, a woman named Dr. Shannon Fox Levine, who had been stewarding the organization and growing it, and an exceptional care model that we said, hey, if we can bottle this magic kind of clinical model up and export it to more and more places, we can really make an impact, not only in Palm Beach County, but across the state of Florida and across the country, at Bluebird Kids Health. And so that was really the genesis of our organization, was a partnership with Palm Beach Pediatrics, taking this incredible care model that had already touched tens of thousands of people across Palm Beach County. And now we're opening up additional locations, both kind of a little further south down into closer to Fort Lauderdale, as well as a second market up in the Jacksonville area, and targeting those areas that I refer to them as like pediatric care deserts, areas where there's a lot of people, but historically there has not been a lot of investment in like community-based healthcare infrastructure. So we're excited to continue that legacy now under the Bluebird Kids Health organization, and continue to grow those 3 locations. And I know it's a busy week, right? It's school vacation week, and so I know that that's a very, very busy week for pediatric practices. But we're excited to welcome many more folks into those existing locations, as well as new locations as we start to open those up.
Yeah, we'll keep an eye out to see where else you're going to come up. I know tons of places up in Florida. You have to hit the central area now. Certain areas. Yeah. There's a lot of growing cities that I didn't know about. I used to live down in Boca, and I moved up more central Florida on the East Coast. Yep. So I see differences. I'm only 2 hours from Boca. It's so crazy, but it's so different. The weather's different. 2 hours. The weather's different. People are different. It's just interesting. But I have my struggles too, trying to find doctors, and I have I take care of my mother and my aunt, so we have seniors in the home. So.
Oh wow.
Yeah.
You get your hands full.
Oh yeah, yeah. And my mother's 87. She just turned 87, and my aunt's 85. Yeah.
Okay.
So they're physically pretty good. It's the memory. It's the dementia, the Alzheimer's. It's the worst thing ever.
Oh, I'm sorry. That I know that that's both physically requires a lot to take care of older folks, but I think also I imagine the emotional aspects of dealing with dementia are very challenging. So
the emotional. I didn't realize how much until I went through a little bout of I got run down, but I'm better now. I'm managing it better now. So it's not too bad, but it's hard to see people change, people that you love, and then you see what's happening and you can't do anything about it.
Yeah, I'm especially when it's a parent, right? And that they were the top of the world. For you for so long, and then you kind of reverse roles all of a sudden.
They're like 2 bratty kids now. But I just say real quick, my mother's 87. She's a pianist, and she can still play. She remembers, so she can still play her Chopin and Tchaikovsky like there's no tomorrow. Like she'll be on the piano, but she won't remember she had lunch. So
as I said, hopefully she's smiling.
Yeah, she is. I put the music on. As long as there's music, we're good.
Yeah.
So where should everybody find you if they were interested in going to Bluebird Health?
Yeah. Come to our website, bluebirdkids.com. And from there, you can access all of our locations. You can book a new patient appointment right from the website as well. And we have extended hours, both in the evenings as well as some weekend availability as well. So we look forward to hopefully caring for some of the folks listening to the show here, and hopefully maybe even some are already patients of ours.
Yeah, I'll share it out to a lot of different groups as well, where there's a lot of parents. I do know a whole group of parents that have autistic children and children on the spectrum as well. So that's also, they have a hard time finding medical care, because a lot of times they're on Medicaid or some kind of form of state insurance. So that's always a challenge.
Absolutely. We try and welcome all children into the practice. We integrate behavioral health. We're not a autism specialist, but most of our providers are trained in behavioral health, and then we actually employ some behavioral health providers in our practice as well to support our patient base. I think that's to your earlier comment about how things have evolved in our country. I think behavioral health is becoming more and more. I don't know if it's more prevalent or just more recognized as a really important condition, and we've really focused on making sure that we're not dividing. Sometime, I don't know, 50, 60 years ago, people said physical health and mental health are different things, but it's the same person, and it's the same circumstance and situation. And so we try and do everything we can to actually bridge that gap across the practice.
That's very important. And I'm happy you mentioned that. I forgot to mention about that because there's been a higher rate of child suicide, which just boggles my mind because, being a kid, I'm like, that would be the last thing on my mind. But unfortunately, society has changed. Like we talked about society, community, that sense of not having a community, I think is injuring children too, So, did you freeze up? Oh, there you are. You froze up for a second.
Froze for a second. Apologies.
Yeah, I was like, did he freeze?
I heard you. It is, and I have kids who are about to start to enter middle school, and so I know that's an area that we have to have our own. We have a lot of our own conversations about making sure that people are confident in who they are, and there's a lot of all of a sudden as cell phones and internet access becomes available. It's definitely different than when I was growing up.
It's true.
And I don't know that we've quite figured out how to manage it as a country. And I think pediatrics plays a role in that, but there's probably some bigger social dynamics and to your earlier point, community-based things that we need to do as a community to support kids and just have norms around how we think about interacting and supporting our children.
I mean, I can't believe it's 2025 and that I'm talking about that we have to now teach our children how to go play outside, basically. Okay. That's what we have to do. Leave the phone inside and go get some grass outside.
Go get dirty. Yep.
Get dirty. Scrape your knees on the sidewalk like we used to.
Exactly.
So that's my take that your kids' health, the Bluebird kids' health it's going to empower the parents a little more to know more, right? To be able to be more proactive in their child's health and to understand it more. And I think that's awesome because they need to do that. I always say they should have, we should have cooking classes or something, or like partner with people like that so they can, because a lot of people don't know how to cook. I cook every day. I cook for 5 people every single day. Okay. Because I want to make sure my mother and my aunt eat healthy. So I don't buy processed food. I don't buy frozen dinners. Are you kidding me? I can't.
Yeah. But it's hard. I'm sure as you know, it is hard.
It's hard. It's hard. I mean, you have to go into a routine. I tell people cooking is not difficult. If you make it like you're in a recipe book, you don't do that when you don't know how to cook. Just simple. Grilled chicken. It's simple. Put in the oven. Air fry. Broil. There you go. You know what I mean? You can do simple things, and hopefully parents get a more understanding when they have children that they have to eat healthy meals in order. Part of the health. Part of it going to the doctors the same way. So they're hand in hand.
Absolutely. You sound like a much more skilled cook than I am. I'm good if I have my 4 or 5 things that I can whip up. But you sound similar to my wife, where whatever's in the fridge, she knows she can make like a good meal. I sometimes have paralysis if my core ingredients aren't there. But
I had my grandmother. May she rest in peace. But my grandmother was my guide. She always was the cook in the house. She was the woman of the house that made dinner for everybody. And since I was 11 years old, I've been cooking. And so I love to cook. I find it like therapy for me. It's like my time to just kind of unwind, and I smell the foods and I just kind of get into it, and then the food comes out really good because I'm so into it, and I'm thinking, oh, this is really good. Like I love when I do something, I go, man, this was really good. I
love it.
So even when my children were little, I would cook. I used to laugh at people. I go, why are you buying baby food? What is wrong with you? Your child was just born not too long ago. 6 months old, you're going to stick chemicals in their mouth? You take a sweet potato, boil it a little bit, smash it up. There you go. There's baby food. Banana. You just smush it with a nut. I mean, it's like simple things. You know what I mean?
I think to some degree, we've kind of, I feel like generation to generation, maybe we've kind of forgotten how simple it actually can be. Right. But yeah, no, for sure. sometimes it's actually even easier to be healthy, right? And maybe that's something that we
So
don't.
there's a give and take, because it's
Yeah.
sometimes you have to be thoughtful, mindful. That's how I call it, right? You have to be mindful, even if you go out. Like I've for the last 8 years, I've been really mindful. I changed my life, and because I was sick, and changed all my eating habits, lost weight, just everything. So that's why I do the podcast as well. Is just giving people information. You know, it's like, I did it. This is what happened to me, and it worked. So that kind of thing. So I try to, that's why I try to get these messages out to everybody, so people see there's an alternative. And now they have an alternative for kids' health. And so many people that I know have children. So take advantage of it and get some, good relationships with your doctors.
Excellent. Well, we really appreciate you highlighting Bluebird Kids Health, and I hope many of your viewers get to experience the really amazing care model that our providers deliver each and every day. And I'll just reiterate, we are welcoming of regardless of what insurance, whether it's Medicaid or CHIP or commercial payers, to our practices. And I think you will find that it's really, regardless of if you live in public housing or you live in a multi-million-dollar home, I think it, and I believe it's the best pediatric model that exists. And so everyone gets to experience just exceptional care and customer service.
And that's the way it should be. All children should be equal.
Absolutely.
And be able to get to the best health they can and best services when it's available. So I appreciate you, Mr. Johnson. Thank you, Chris. It was awesome to have you here and talk to us about your company and how you're transitioning and making kids' health better.
Alida, thank you for having me. I really enjoyed the conversation.
Yeah, you're welcome. You're welcome. Thank you. Bye-bye.
Bye-bye.
Hey, everybody. Well, thank you so much for watching the show today, and make sure you subscribe to our channel. If you're on Rebooted Mindset 555 on YouTube, or you're on Spanglish Entertainment, we're on both sides. You'll see some stuff on the magazine. Don't forget to check out the latest magazine, Spanglish Entertainment. A lot of new articles in here, and always did you know section. A lot of good, interesting stuff there. So check it out. And if you want to advertise as well, just let me know. We got a lot of space going on, got some promotions going on. And we also have our cruise. So don't forget our cruise, October 24th to 27th from Port Canaveral to Celebration Key. We're going to have a Spanglish party cruise. We have 7 salsa artists, and we just added a freestyle artist, the Nasty Boys. So it's going to be amazing. So you have to check that out. So anyway, thank you again for tuning in to Rebooted Mindset, and we will see you next week.